My name's Katie Horton and I'm a senior physiotherapist and a clinical educator for the University of Nottingham, and I work in the Pulvertaft Hand Centre.
My name's Ian Shelton. I'm a senior occupational therapist working here at the Pulvertaft Hand Unit, and I also work at the University of Derby.
So here at the Pulvertaft we see a wide range of patients from trauma and non-traumatic injuries. So we might have somebody that's had a flexor injury, or somebody that's had a fractured finger, to somebody that's had a tennis elbow, for example. So we use the BTE for a wide range of patients.
We're under pressure to see patients in a 30-minute slot, also the amount of resources that we have. We're also starting to use it for research purposes, so we've been approached to try to look at biceps pre and then post repair. So using it to get the data for power in newtons, and then we can produce reports and hopefully use it going forward in research studies, because it gives us that standardised measure that's reliable.
So we use the BTE a lot for denervation assessment, so this means that we use this piece of equipment to be able to prove whether somebody's suitable or not to go through with surgery. So within that we look at work output and then we link it to pain. We also then look at their endurance and see whether there is a difference pre and post a block, and then that would mean that we would be able to say whether they are suitable for surgery. So the data that we get from the BTE, we provide them to the consultants, which makes them have the decision that they need. And we use the BTE as part of a circuit, so we'll set up a piece of equipment either normally on both of the BTEs, and we get our patients doing a circuit-based activity on the BTE. So we've changed the way that we rehab a lot of our wrist patients now, and we've noticed that although people are often weak in the wrist, we've had a link between upper quadrant stability and reduced strength generally as a whole body. So we have gone away from rehab at a table, so doing flexion extension at a static base, to now doing whole body dynamic rehab. And we found from a wrist point of view, this has really helped our outcomes, and we've had people that have got a lot better quicker.
We use the BTE for a lot of work-based simulation tasks, so a lot of digging, a lot of lifting. We find that it's really useful because patients stay motivated, they can see some standardised measures, some goals. It gives them motivation that way. It's also, we think, quite a space saver, so we can use it like a multi-gym and we can do all those simulated tasks at the same time.
So in terms of how we use the BTE with our surgeons, we complete denervation assessments, and our surgeons like to see a difference between work output, endurance and strength pre and post an injection. So we use that data then to be able to provide to the doctors in terms of whether we think that the denervation would be successful or not. So we provide lots of reports from the BTE.
We've also used it for reports for motocross people, so simulating the pump that you get when you're on motocross. You can produce that kind of data for them. And as we said before, we're now using it to try and do some research, so for biceps testing pre and post.